When Saharo Noor came to San Diego from Somalia 18 years ago, she was pregnant. When she went into labor just weeks later, her Western delivery room felt familiar. She was a midwife and a registered nurse back home. But delivery wasn't easy.
They asking me, what's wrong? What's wrong with you? Why you didn't, the baby's not coming out? Because everything is sewing.
Like a lot of East African women who came to the United States in the 90s, Noor was circumcised. The cultural practice removes parts of the genitals, stitches and scar tissue, then narrow the birth canal. For a circumcised woman to give birth vaginally, the doctor would have to make incisions to reestablish the birth canal. Doctors in the United States rarely see female circumcision. Noor's doctor had never seen it. Noor couldn't speak English at that time. She tried to pantomime the needed procedure, but it just didn't work.
And they didn't understand, and everything the baby cut by himself, and I get a lot of pain, a lot of bleeding.
The baby is fine. In fact, he's studying engineering at San Diego State. But Noor's pain eventually gave way to permanent numbness. Her story is just one in a catalog of medical mishaps and nightmares refugee women in City Heights are sharing with their community. They're asking residents to sign a petition to get insurance providers to cover face-to-face translation in doctors' offices and hospitals. Zuletka Wacho is from Ethiopia. She came to San Diego by way of Oregon.
It's a lot of people that are afraid, frustrations and worry too much. What's going to happen? What's he's going to say? Because of not understanding. You worry, are he going to be help me or are he going to be damage me? Because you're not really comfortable what he says, what he's going to do.
Wajo said refugees often put off going to the doctor because they fear it will make things worse. Some of the women report getting a wrong medication, a misdiagnosis, even a wrong surgery because they can't communicate with their doctor. Wajo said she recently went to the doctor to have a persistent rash looked at. She got it 6 years ago. Wajo and Noor helped interview more than 200 refugee women with similar stories earlier this year.
So those of you who took part in this study, can you raise your hand?
Researcher Bill Oswald helped with the study.
2/3 of the women generally said that they have no idea what their doctor is telling them. They have no faith the doctor understands them. They don't know what to do when they get their aftercare, and they have very little awareness of what the medicine is supposed to do or how they're supposed to take it.
The state offers translated prescription labels for free online. It also passed laws requiring that all providers be culturally competent and never rely on children to translate for their parents. But a slapdash approach to translation is the status quo. Most often, family and friends are pulled in to do the work. Prescriptions are rarely translated. In San Diego, the La Maestra Clinic on Fairmont Avenue is a model because it hires from the refugee community. But still, those employees have to serve multiple roles because the clinic can't bill insurance companies for translation alone. La Maestra also has to refer patients to specialists in hospitals where translation isn't readily available. Most doctors' offices provide translation over the phone, and refugee patients cite one major problem with that: the translators can't see them. This room provides a solution. It's set up with an exam table, a camera, and a big screen TV that can connect with other doctors' offices. Patients and their La Maestra interpreters can meet with a specialist remotely. Zara Marcellian is the founder and CEO of La Maestra. She said telemedicine is the only way she'll permit translation over the phone. She says the phone service specialists and hospitals use doesn't go far enough.
They don't have any background information on what's happening here, California, in terms of what program they could qualify for if they get into those kinds of conversations or translating those issues. They won't know. They won't know where to hook the patient up to or where to send them for help because they're outside the city, outside the state. So to me, it just is like, it's getting the job maybe a quarter done.
Wacho agrees.
We need quality interpreter to include to our insurance face-to-face. That's what we're asking for. We don't want anymore to be barrier our health.
The women will send their petition to the board handling California's new health exchange under the Affordable Care Act. The board is tasked with setting regulations for participating insurance companies. In the meantime, Noor says she sees one glimmer of hope. Second-generation refugees are studying medicine, including her own daughter, who recently graduated from UCSD. Megan Burks, KPBS News.